Hello, I'm Paul Westerman, the Managing Director of RBR Active Limited. I just want to take this opportunity just to introduce myself to you, to tell you a little bit about the company, but most importantly, to tell you exactly why RBR Active has been set up and why the RBR leg flow is such a vital piece of medical welfare and care equipment in the treatment, prevention and awareness of thrombosis. In 2011, I suffered what's known as a massive pulmonary embolism. I was rushed to my local hospital and I then spent several days in the ICU. Upon being discharged, I started researching things about thrombosis. I wanted to know why it happened, how did it happen, should I have known things, should something have been done differently. As I went through the research, I then later became a patient representative trustee of Thrombosis UK up until July 2018, a position I was incredibly proud to undertake. I'm also a member of the NICE committee looking at thrombosis awareness, care and treatment within the NHS. As I researched and as I spent more time with clinicians and patients and doctors and nurses who are all responsible for the care, treatment and prevention of thrombosis, I had the absolute pleasure of meeting and discussing things with Professor Richard Beasley at the Medical Research Institute of New Zealand. Richard had recently published a paper on sedentary workers and the threat of DVTs. And within the paper he mentioned a concept design that he believed would and potentially could reduce the threat of DVT for people who are living or working sedentary lives. So we looked at developing the actual product as a concept. Independent clinical trials were then run and the results came back and they were absolutely amazing. Basically, the product increases blood flow to the lower limbs by 11-fold. This significantly decreases any threat of a DVT. So if you're a sedentary worker, for example, in an office, in a call centre, or if you're in a retirement home, a care home, or if you do fly a lot, or if you play on your computer games a lot, or you binge watch the Game of Thrones kind of programs, then you are sedentary for more than 90 minutes. And that increases the chances of getting a DVT. So we developed and created the RBR leg flow, which is a simple medical device that goes on the floor. We've created 3 key exercises, and these exercises, along with the equipment, increase blood flow. Now, if I had known now what I know about DVTs and thrombosis, would I have done anything differently? I probably would have, but at the time I didn't. Am I pleased? Am I happy that I'm now in this position where I'm sat here talking to you? We've got the product, we've got the clinical research, we've got the clinical trials, we've got accreditation by the MHRA, we're anti-micro, everything screams, wow. What I want for the RBR leg flow is for it to be in every NHS hospital, on every flight, every care home, every residential home. If you're sat there binge watching Game of Thrones and programs like this, and you're sat still, you're sedentary for more than 90 minutes, just 90 minutes, then potentially the RBR leg flow could just save your life. It's fantastic. It's 2019 and people are sadly still dying of thrombosis. That a lot of the time there's no real reason for it. So thank you for your time, thank you for listening. Please contact us at rbractive.com. Please phone me at any time, email me. I'd love to talk to you, and if we can work together to get the RBR leg flow into your environment, to keep your staff safe, to keep your residents safe, to keep your passengers safe, it'll be fantastic. It's been a pleasure working with the likes of Professor Beasley along the way, and I can't wait to see what happens in the future. Thank you very much indeed for your time. Thank you for listening, and I look forward to hearing from you soon. Thank you.